Are you struggling with limited neck mobility and pain from a C5, C6 disc bulge? Tired of constant neck stiffness or tingling in your hands? Imagine moving freely without these daily discomforts. In this video, I'll share a targeted set of exercises designed to strengthen, stretch, and enhance the mobility of your cervical spine. How do I know these exercises work? With 24 years of clinical experience, I've seen these exercises help hundreds of my patients with C5, C6 disc bulge regain neck mobility and quality of life. They didn't just work for my patients, they also worked for me after I suffered neck pain from a disc injury with a car collision. These simple, effective movements can be done anywhere, at your desk, in your car, on the go. By following these exercises, you'll increase your neck's mobility, begin to reduce pain, and improve your overall quality of life. Stay tuned and transform your neck health today. Hi, I'm Dr. Raminder Burke, a chiropractor in Woodbridge, Ontario, Canada. We have helped thousands of patients recover from spinal conditions such as disc bulges, herniations, degeneration, lumbar stenosis, sciatica, and radiculopathy. We use non-surgical spinal decompression as the cornerstone of our unique and proven back-to-life method. Be sure to hit that subscribe button if you want do-it-yourself tips, strategies, and exercises that will help you relieve and manage your back and leg and neck pain. Plus, you will discover which therapies are the best for treating disc bulges, disc herniations, and other spinal degenerative conditions. I'll upload a new video every week. In addition to that, I wrote a book called Back to Life. Imagine getting your life back while getting your health back. You can get a free copy at the link in the pinned comments below. In a moment, I'll guide you through a follow-along routine designed specifically for those dealing with a C5, C6 disc bulge. The order of these exercises is crucial as they progress through different stages, each targeting specific outcomes to benefit your spine and alleviate disc injury symptoms. First, we're going to start with mobility exercises to gently increase the range of motion. This prepares your cervical spine for further activities and helps to reduce stiffness around that C5, C6 area. Next, we'll move into stretching exercises, which elongate and relax the muscles, alleviating tension and reducing pain. This is vital for creating space and reducing pressure on the affected disc. Finally, we'll finish with strengthening exercises to build stability and support in your cervical spine. Strengthening the muscles around the spine helps to support the injured disc, reducing pain and preventing future injuries. By following this routine, you may experience improved neck mobility, decreased pain and discomfort, and enhanced overall spinal health, leading to a better quality of life. Let's get started. Okay, we're going to begin with some of our general mobility type of stretches. And in the beginning, obviously, we want you to start with light and easy. If you have very restricted ranges of motion, it's just to get moving just gently past your general range of motion. So let's start with turning the head to the left. As far as you can, give it a hold for just 1 second. Remember to keep breathing, going to the opposite side, to the right. Hold. Now coming back to neutral. We can go back, extend your head back as far as you can comfortably, and bring your head down as far as you can comfortably. Feel a stretch, hold, and breathe through these ranges of motion, coming back to neutral between each one. That's the beginning stage. Next, we're going to just do a lateral flexion. So tilt your right ear to your right shoulder, hold for 1 second, going to the other side as far as you can comfortably. I always like to start with just getting to as far as you can go back to neutral. These you will push past ranges of motion as you warm up each direction. So remember to do each of these directions 2 to 3 times. Remember to breathe and control the movement. The next mobility exercise is going to be rotational with left and right, looking up and over to the left and right side. So Ashley's going to begin coming from the down position up to the left side as if you're looking back and over your left shoulder. Come back down in a semicircle to the other side and look back and up. Remember to do the breathing and feel that stretch at the end of the movement. We're going to repeat that for a count of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. If any of these movements cause any lightheadedness or dizziness, make sure to stop at any point that you need to. Okay, so now we're going to go into a bit more advanced movements for mobility. The next one we call the cervical extension, isolated cervical extension, or ICE. So basically here, we're going to have two versions of this. One is the beginner stage. You're going to hold the neck with 2 fingers on each side at about the C5, C6 level, so mid to lower neck. You're going to pull forward as you extend your head back. So go ahead and keep breathing. Hold in that contraction there for 3 seconds and come back to neutral. Again, pulling forward as you extend your head back. They'll feel a sense of relief in the tension in your neck and shoulders. Repeating this 3 to 5 times, anytime throughout the day, at the stoplight, at your desk, helps take out tensions in those tight muscles around the trapezius and posterior neck muscles. So repeat that throughout the day for a series of 3 to 5. Next would be the more advanced version of this is going to be with a towel. So we're going to actually use this towel, roll up a hand towel, place it around the neck just like we had our fingers. And what we're going to do is pull the towel forward as you extend back. So this will give more of a deeper stretch on those facets and inflammation around the back of your neck. Same idea. We're going to pull forward, breathe, extend back, feel that deep stretch for a count of 3, come back to neutral and relax. We're going to repeat this for 3 to 5 times with a nice pulling forward movement. Remember to breathe. And if at any point there's any dizziness, stop doing the movement and take a break. The next exercise is going to be a stretch. We're going to get into the stretches with the main one that I like to give is called the upper trapezius stretch with the cervical involvement. So what we're going to do here is you're going to begin seated on a stool or a chair, and with one hand, let's grab the bottom of the chair, feel that stretch already beginning in the shoulder and the neck, and using your opposite hand, put your hand on the opposite side of there on the head and pull in both directions. So what you should feel is a stretch down your arm and up into the back of the head, a nice deep stretch here, holding for a count of 5. We're going to do the other side now, the left side. 1, 2, 3, 4, 5. Remember to not bring up your shoulder when you do this. You're pulling with the chair. And now we're going to do this from the back of the head. So we're reaching the back of the neck muscles. So now she's going to pull forward and down towards the opposite knee and feel that deep stretch for a count of 5, 4, 3, 2, 1. Next, we're going to go to the opposite side. Same movement. 1, 2, 3, 4, 5. Coming back to neutral. And now we're going to go in the opposite direction, pushing with our hand to the forehead and bringing our head back, which will stretch the front of the neck. 1, 2, 3, 4, 5. And again with the other hands, switching to 1, 2, 3, 4, 5. By doing this stretch in all directions, you're really getting the back of the neck, the trapezius muscle, and the front of the neck where we have key muscles that get tight from the forward head posture we create being on our phone and our computers throughout the day. So remember to do each direction for a count of 5 and repeat 3 to 4 times throughout the day. Now, as we get into more of the strengthening type exercises, the simplest one can be done at our desk and in our car. Begin seated or standing, looking forward with your shoulders back and good neutral posture. Remember to activate your core, feel stable, and attempt to draw your head directly backwards by placing your hand on your chin. This gives you a guide and feel of the movement. You're going to hold for 2 seconds and return to the start position. Back again. 1, 2. You're going to feel this at the back of the skull. You're going to bring your forward head posture back, and it's going to train yourself to hold that good, healthy neck posture, which takes the stress off your C5, C6. Repeat this for 3 sets of 10, multiple times a day to reinforce good posture. The next level we're going to go to is strengthening. So I really like this one here. We call this the Rhino Strong neck exercise. This is going to create mobility and a stretch and strengthen at the same time. So Ashley's beginning by lying at the edge of a bed or a bench with the head hanging over and feeling just a relaxation, a deep stretch in the front musculature of the neck. So just lie down and relax for a minute, taking deep breaths, feel that stretch and deep stretch to tolerance. Don't overdo this, as anything that we want to do here is to create a relaxation and not cause aggravation. So the first thing that she's doing is holding that position, breathing through that for a count of up to a minute. And next, basically like a sit-up for your neck, Ashley's going to bring her chin and head up towards her chest, contracting those muscles, coming back down. I like to see engaging the core even at this time. So it's basically a full contraction. 1, nice and controlled. 2, 3, 4, and 5. Going back into the neck extension, relax into that. You're going to get a nice sense of blood flow and movement in the neck. Repeating this for 3 to 5 sets. As you get stronger, you can increase the set to reps of 10 reps 3 times with a minute deep stretch in between. And some patients, as they finish this exercise, really end up lying and relaxing for another 5 to 10 minutes further to feel a deep relaxation, getting ready for bed. This is a perfect time to incorporate the Rhino Strong neck exercise. You now have a set of targeted neck exercises specifically designed for the rehabilitation of the neck when dealing with a C5, C6 disc bulge. Bookmark or save this video so you can easily return and follow along the exercise routine as needed. These exercises can be safely done every single day. And remember, never push through any exercises if it causes increased pain. Always listen to your body and perform these exercises within the ability and tolerance of yourself. Now, I want to hear from you. Which exercises did you like best and gave you the most relief? Was it the cervical extension with a towel, or was it the Rhino Strong neck exercise? Leave me a comment and let me know. And if you found this video helpful, please give it a like and share it. Your support can help others learn how to manage and treat a C5, C6 disc bulge more effectively. And let's create a community where we support each other on our journey to better neck health. Share your progress, ask questions, and encourage others to stay committed to this rehabilitation. Remember to subscribe to my channel now if you want do-it-yourself tips, strategies, and exercises that will help you relieve and manage your neck and back pain at home. The next video you should watch is this one, where I explain in detail how to treat a C5, C6 disc bulge without surgery. Go watch this video now.